And how about this? Striking out on their own. Washington, Oregon, and California taking a detour from federal policy when it comes to vaccines. Those three states just formed the Western Health Alliance to coordinate vaccine guidelines.
And that move is a response to the federal government firing experts, also narrowing the pool of those who should get a COVID shot. Let's bring in Lisa Balick. Tonight she's looking into this new health alliance and what it means. Lisa?
Yeah, the governors of those states say they want to protect public health for the people who live here as well as in Washington and California, even if it means defying the federal government and the possibility they could lose federal funds. Likely, you won't find any lines for COVID shots this year after changes to vaccine guidance by the Trump administration. The Centers for Disease Control and Prevention has decided those shots are for those ages 65 and up or people at higher risk of severe disease. Now, governors in Oregon, Washington, and California are challenging that. Their newly formed West Coast Health Alliance will make joint recommendations on who should get certain vaccines. They say the decisions will be based on science-gathered information from national medical associations.
What that means for us in practice is looking at those organizations that have been doing vaccine policy, vaccine recommendations across our country for many years. A good example of that is the Academy of Pediatrics that have been doing vaccine recommendations for over 80 years.
Our goal is to ensure continued access to vaccines with no out-of-pocket costs to consumers in Oregon. And so again, there are various levers that we are actively exploring alongside our partners to ensure that.
The Democratic governors of the three states say the federal government is politicizing the CDC and pushing anti-vaccine policies. State health leaders say they'll rely on data and science when it comes to who should get the shots, starting with the COVID shot for children 6 months old and up.
The American Academy of Pediatrics looked at recent data that showed that kids under 2 have the second highest hospitalization rate after older people. And so they're vulnerable to complications from COVID.
The Federal Department of Health and Human Services responded to this new three-state alliance, saying in part, Democratic-run states that pushed unscientific school lockdowns, toddler mask mandates, and draconian vaccine passports during the COVID era completely eroded the American people's trust in public health agencies. Now, I asked, what about losing federal funds? Is that something that you're willing to gamble? And both Washington and Oregon health directors said, look, we'll see what happens. And certainly the courts have been used in the past and could be used again. Back to you.